We have a super panel coming up, which is going to look at how to leverage partnerships and innovation for impact. I would like to welcome my esteemed panelists to help dissect this discussion. We have Malick Joos, CEO of Vestergaard. Thank you for joining us. We have Dr. Caroline Boulton, Global Program Head Malaria Novartis. We have Dr. Malick Diara, who is a Public Health Manager from ExxonMobil Corporation. And we have Michael Sternberg, who is a Team Lead, Global Public Health and Special Projects, Chevron. Thank you all for joining us. This is a very interesting panel because it's totally focused on the private sector. And I can't wait to have your contributions. So I will take my first question for Dr. Malick. Last year, ExxonMobil celebrated 20 years of combating malaria, and partnerships was a key part of your strategy. How does ExxonMobil coordinate or collaborate with other entities and NGOs working on malaria? Why are these kinds of partnerships so vital? Dr. Malick, please share with us.
Thank you, Ochuko, for the question, and thank you for highlighting the 20th anniversary of our involvement in the global fight against malaria. I would like to make two statements related to this question. The first is really to see that the health and the safety of our workers, but also the communities where we work, are an integrated part of our business approach. It's a part of our DNA. So malaria comes into play automatically. And the second part is that we do value partnerships because we consider ourselves as a global health, a part of the global health community. And we do know that no one can do it all, whatever is your level of resources. And I will illustrate these aspects in terms of how ExxonMobil got involved into malaria, from the workplace to the communities, and how we work with the different partners to make that happen and successful where we operate. So we started in the early 2000s while working in the Chad-Cameroon pipeline. And while operating there, we really saw how the disease was affecting our workers, our dependents, the families, but also the communities as we were looking at the interventions into the environment. And it's also a very big productivity issue, as mentioned by a number of speakers today and also before. And you can have employees missing work due to malaria for themselves or for their family, taking care of their wives, or children. And so it's definitely a business imperative, and you cannot operate in a world where the social and health aspects are so affected by something that you've mentioned in your previous panels, that it's treatable and it's preventable. But we still see that high burden on the workers, but also in the communities. And we implemented an ABCT program, very strong, very, I would say, comprehensive. And while we were having hundreds of cases in the early years, we are now having less than 5 cases per year across our operations. And that's mainly for the non-immunes. But in terms of fatalities, we haven't had any fatalities for more than 15 years, knowing that this is something that can affect people pretty drastically. But we know that the employees also are not truly protected from malaria as long as it continues in the communities. The mosquitoes do not know the borders, and they do not know also the fences. They fly over, they can go from country to country. So it was important for us to also look at how to invest in the communities and help address these issues. And looking at the success we had within our workplace, the corporation through the foundation started investing in malaria. And we have partners across the globe because we know that this is something that should be addressed widely and not just within our workplace or just within the countries we operate. So we have a number of partners with whom we work to deliver life-saving interventions, including bed nets, rapid tests, anti-malaria drugs, development of vaccines and new medicines, and the research to address anti-malarial drugs and pesticide resistance. But one very important point that was also mentioned earlier by Dr. Kalu and also by Dr. Newman is that we have to strengthen the systems to be able to respond to the needs of the communities. And within that health system strengthening, it's also important to integrate a component related to leadership training. And thanks to our partners since 2000, we have reached more than 1,525 million people. Am I on time?
All the time.
Yeah, okay. And I would say that our efforts have been rooted in really strengthening the systems. And we do know that working with partners is important. Each partner should come with its own strengths and help the others achieve that zero malaria that we are looking at. So I'll stop here just in interest of time and for respect to the others.
Thank you, Dr. Diara. Thank you. I like what you started with. You said partnerships and it's part of your DNA. It's part of ExxonMobil DNA. That is very strong. And you also said for the past 15 years, no fatalities you've not encountered any fatalities in your workplace program for the past 15 years. That's huge. Yeah. And that shows that investment in malaria workplace program is very important. I'm sure the audience is hearing. Investment in malaria pays to businesses, to the society, and the world at large. So my next question goes to Michael Joos. Vestergaard is very, very strong on innovation. Even the Global Fund mentioned partnership with Vestergaard. How can the malaria community and private sector better partner together to bring innovation to markets and accelerate to elimination? Over to you, Michael.
Thank you so much for that question, and also thank you so much to you all for setting up this platform to exchange between the public and private sector. It's a great privilege to be with you today and to speak to you today. For those that don't know Vestergaard, we are a 60-plus-year-old family-owned company, which is best known in the public health and malaria space for its permanent brand of bed nets, where we are very proud to count down towards that 1 billionth manufactured bed nets. And for us, doing good is indeed good business. And as a result, we don't invest in any business on the business plan without having a clear social impact, as is clearly the case here in malaria, but also in the world of food security, etc. Bed nets have been the foundation of any malaria prevention effort, quite frankly, and since the millennium, over 2 billion bed nets have been generously funded by $8. And this humble bed net has actually been responsible for reducing almost 70% of, well, let's say malaria cases have been averted in sub-Saharan Africa since the millennium. And they are therefore truly the backbone of any malaria prevention program, on top of which additional interventions such as chemo prevention and vaccination efforts that we have learned about are layered. As we've already heard from Peter Sands and John Fairhurst and others, COVID has placed significant pressure on malaria programs. Recent reports showing that there's been a steep decrease in malaria diagnosis and treatment because of the pandemic, where some facilities had up to 20% less, up to 20% of facilities have been surveyed had no malarial medicine. And of course, this affects children under 5, which is the most vulnerable group here the most, as we know still today, before COVID hit. Every 2 minutes, a child under 5 is still dying because of this disease. So as such, the Humble BedNet is not just the backbone of a malaria prevention campaign, but it's literally holding up the fort currently in trying to avert cases of COVID. We commend the amazing work done by the donor organizations, but also the local country malaria program managers and their teams, and most specifically the frontline healthcare workers that have been mentioned again and again about just the amazing work that they have done to make sure that these BedNet campaigns are delivered on time and to avoid any further issues. However, the BedNet game has really gotten a lot tougher. Growing mosquito resistance towards agrochemical insecticides used on current generation BedNets are fast making them less effective. And new generation BedNets with new generation insecticides must be brought to market quicker than what we have done in the past. There's a quantum change in complexity management required. Complexity of screening for the right active ingredients, complexity of the polymer science and how to put these active ingredients onto a BedNet in such a way that the sleeper is safe and that these BedNets are effective against killing mosquitoes for a long period, 3 years at a time. And then the complexity of manufacturing is also going to become a lot more difficult going forward. So the malaria community must learn to work more strategically, we believe, with manufacturers of BedNets. And we applaud the work done by the IVCC, generously funded by the Gates Foundation, among others, in this area in helping to bring innovation to the space. However, technical development is really not enough, and we must also learn to launch new generation of BedNets much faster than what we've done before. We believe this really requires a full review of the regulatory pathway to market, so that we have faster adoption in the field and have a faster evaluation of efficacy of BedNets in the field, what works, what doesn't work, etc. And this information must be made much more readily and speedily available to everyone. Additionally, we know that a large portion of BedNets are not actually used. Estimates go from 20, sometimes up to 40% of BedNets are not used on any given night. And this is a massive issue. If we accept that the BedNet is such a vital portion, the backbone of a malaria prevention campaign, then not using BedNets obviously must be an issue. And I think we need to look at this challenge with a new perspective and maybe ask ourselves, how can we improve programs locally on the topic of usage? Maybe there's a space for digital innovation here. Certainly it's an area where we are working on quite a bit ourselves. Lastly, maybe the fact that, with any kind of 5-year time frame, the malaria community does deliver 500,000 tons of polymer plastics to just the sub-Saharan African continent. This is enough plastic to cover the island of Manhattan 200 times. And I think we need to find environmentally friendly end of product life pathways, including, quite frankly, recycling. Polyester can be recycled 100%. And surely this is a great opportunity for the malaria community also. So to wrap up, to find innovations and to deal with these complexities, we must work strategically across the malaria community. I believe the donor support organizations, donor fund support organizations, country NMCP management and organizations, suppliers like us need to probably do a better job at work across industry and cross malaria community on some of these core these core issues that I've identified today and that have been very well already identified by multiple speakers. And we call on the community to really help do that. So again, thank you to GBCHealth and CAMA for this great opportunity to speak about some of these issues today.
Thank you, Michael Joos. That was a great presentation. We need to learn to work more strategically together to bring new innovation tools to the market. And you said it's very interesting. I've never heard the bed net being highlighted in this way before. You said the humble bed net is the backbone of malaria prevention. Wow, that has really sunk. So thank you for sharing that with us. Dr. Boulton, Michael has talked about innovation and bringing new generation tools to the market. I know Novartis is very huge on treatments. I would like for you to share with us how Novartis has played and how you have deployed your capabilities, your expertise and innovation to produce new generation anti-malaria treatments. Please go ahead, Dr. Caroline, go ahead.
Thanks for the question. It's hard to follow, obviously, the humble bed net in that way. But I think, as most of you know, I think Novartis has been in the fight against malaria for the last 2 decades now. I think we had the first artemisinin-based combination therapy back in 1999, and then the first dispersible pediatric formulation of our anti-malarial as well. And we continue in that fight against malaria. And actually, I think Michael also mentioned going towards the 1 billionth bed net. Well, we've actually just reached 1 million treatment courses delivered of our anti-malarial from 1999. So obviously, hopefully that's contributing to the protection of life out in the field, and we're very proud of that. But I think we all recognize there's a growing threat of resistance out there, and we need new alternatives to those ACTs. And Novartis committed $100 million a couple of years ago, really in that search for the next generation of anti-malarials, non-artemisinin-based alternatives, drugs that are really resistant to or have a barrier to the parasites which have currently developed resistance to existing treatments. What we also want to do, though, as we develop those treatments, is we want to improve the whole patient experience, because we know that some of the regimens that are used today are quite complex, multiple tablets, multiple days. So we're also looking, as we bring these treatments forward, can we really simplify the way that patients have to take them? And that's top of mind for us. And we have a huge Novartis organization who's passionate about malaria working on this. And we have teams all across the world. To address your question directly, Chuka, we have our Novartis Institutes of Tropical Diseases, who are our discovery wing, who are still doing lots and lots of screening. They've got biologists, they've got chemists trying to crack the malaria code and bring forward the next generation of treatments. We have our Novartis Institute of Biomedical Research, who are the organization responsible for early profiling of the compounds as they come out of discovery, putting them into humans for the first time. Then we have our massive global development organization, which takes those drugs, takes them through phase 2 and phase 3 trials, and also reformulates, make sure we've got a formulation there that patients can take. And then, of course, we pass over to our manufacturing organization, which manages the whole manufacturing at large scale and all of the supply chain aspects, I think, that were discussed earlier by some other speakers. But what we do is we bring our innovation engine that's been sharpened with other therapeutic areas, in even gene therapies. We bring all of those, the things that we've learned, back to malaria. So we're applying the same facilities, equipment, technology and standards to malaria drugs that we apply to anything else, which should mean, obviously, we're bringing the most cutting edge technologies to crack the problem. This has actually resulted in a couple of compounds which we're very excited about, which are in the clinic right now. So we have CAT156, which is also known as ganaplacide, which has interesting blood and liver stage activity. So it looks like it could be used to control malaria, but also potentially in prophylaxis as well. And we're combining that with a brand new formulation of lumefantrine, which should allow it to be given once daily. And that's actually in late stage phase 2. So we're very excited that that one will be coming forward in the next couple of years. We have another agent after that, which is K609, also known as sipargamin. Sorry to hit you with all these codes. But that one we're really excited about, because that's actually shown the fastest rate of parasite kill of any agent to date. So that shows real promise, for example, in the treatment of severe malaria. And we're taking that into a phase 2 trial later this year in patients, in young children, to really try and test that hypothesis that this can really make a difference in severe malaria. And as I said, our discovery wing at the Tropical Diseases Institute is still generating new candidates today. And we have a couple more coming out from their activities, which look really exciting, and they appear to offer an even higher barrier to resistance than the compounds that we have in our hands today. And that's really important if you think about the elimination agenda, because we need compounds which are going to stand the test of time. So I think that's a really exciting development to look out for. But of course, we don't do this alone. We develop these drugs with our partners, with Medicines for Malaria Venture. We're also happy that we're funded, partly funded by Wellcome Trust. And these are organizations which share that vision and that purpose to try and contribute meaningfully to the malaria elimination agenda. We're proud to work with consortiums as well, like WANACAM2 and PAM Africa, which are funded by EDCTP. And the value of those consortiums is that we can give more to the organizations outside. Not only are they helping us to run our clinical trials, but we're also helping with capacity building and capability building, because we're running training programs, we're developing individual competencies of investigators in Africa as we're running the trials. So it's really a mutual benefit, both for us as Novartis trying to run the clinical trials and for those for researchers in the field. What we really still face as a barrier, similar, I think, to what Michael was alluding to there at the end, is even if we're successful to bring our innovations through and go through stringent health authority approvals, it still takes too long to get them into the hands of patients and communities. There's still too many barriers that we have to jump over to get from approval through to patients. That can be another 5 to 6 years. That cannot be right. If you look at what's been done for COVID, if you look at how mountains have been moved to get the vaccine out there, why does it take so long to get our new innovative products through to patients? And I'm going to stop there.
Great way to end, and great thoughts that you put in our head in terms of the barriers. I will come back to you with a question on that. Also to Michael Hughes. Yes, I will. And you've given us some hope in the fight against resistance. I'm very happy that there are some new anti-malaria drugs in the pipeline. Thank you for sharing with us, Dr. Caroline. Last speaker on this panel, Michael Sternberg. So we have 2 Michaels on this panel. This is so interesting. Yes, so I have to use your last name as well, so to avoid confusion. Michael Sternberg, Chevron understands that business success is inextricably tied to the health and prosperity of the countries where they operate and employees. How has Chevron's partnership supported employees and local communities in malaria control? And where do you see opportunities for business to partner with governments and local communities to impact the vision of zero malaria? Over to you, Michael.
Yeah, thanks, Ochuko.
Michael Sternberg, yes.
Yeah, thanks. Can you hear me okay, Ochuko?
Sure, yeah, I can hear you.
So yeah, thanks for having me, and I guess to everyone for participating today. It's been a great day of event, so thank you, CAMA. And totally agree with Carolyn's comment about, we need to do better, and that's a whole nother webinar series about doing better, of getting things out to people faster. So maybe I'm repeating some stuff that was shared earlier today, but I was just looking at the World Health Organization article around malaria efforts, and I just wanted to I want to call this out. They mentioned of the 87 countries with malaria, 46 reported fewer than 10,000 cases of the disease in 2019 compared to 26 countries in 2000. And they shared some other stuff well, but to me, it's just a good reminder, like, we can make a difference. We are making a difference. And we're most effective when we're working together towards common goals and commitments and with an outcomes focused. So partnerships are clearly a critical component in supporting our workforce and communities in malaria control. Similar to what Dr. Malick shared, workforce health and safety is at the heart of our values and priorities. We've got strong links, those have strong links to operational safety and productivity and community prosperity. So we work in a lot of malarious regions as well. We've got comprehensive malaria programs, a malaria management and prevention program. Includes tools and processes designed to identify and mitigate risk through training and education. We've got testing, diagnosis, treatment, a variety of other protective interventions and strategies within those programs. And we do a lot of this work with local organizations, with governments, with NGOs, but also supporting global partnerships that support broader initiatives towards system strengthening. I think we heard a little bit about that earlier, global health security efforts. So I think all of these are under those larger buckets that are things that we're focusing on today with our current response to the pandemic. So some examples of how we support our workforce, and similar to, again, Dr. Malick, it does spill over into the communities. We, of course, direct investment. We've worked with organizations in the past, the Global Fund, currently working with Friends of the Global Fight, with some of their critical advocacy work and supporting that. And then locally, I think a lot of our efforts in the private sector can be much more impactful at a local level. So we've leveraged resources and subject matter experts from partner organizations, and not just for Africa, but also other regions where we operate, and there's other mosquito-borne illnesses as well. I think a lot of these resources are very helpful. A lot of the interventions are similar amongst different mosquito-borne illnesses. So for example, we've utilized resources from CAMA to support interventions with our businesses in Venezuela and in Asia Pacific operations. So it's, we can really leverage each other's resources and subject matter expertise well. So we have training and education programs as well for our workforce. And these are often shared with the communities too. We have a peer health educator program where our employees get a lot of training, and then they act as trusted, I guess, ambassadors to share this information out with their peers and communities. So about opportunities for business to partner with government and local communities to impact getting to zero malaria. So I shared a few examples of ways that we partner. And again, I think targeting efforts locally can be really impactful. I think Carolyn mentioned about alliances and coalitions. I think that's a great way that organizations of any size can get involved and support existing initiatives that are already, being successful and already have infrastructure in place. And I think an important part of maximizing effectiveness, is ensuring engaging people at all stakeholder levels. So at the government, at the NGO, at the community organization, other private sector organizations, and even neighborhood leaders. And I think engaging them with the right business case, because it does make a difference to all of us. There's value for everyone, and we need to show that better, I think, with intention and the intersections among safety, the economic impact, the health system impact, value in the ability to keep people working. There's certainly productivity impacts and program and service delivery impacts. And most importantly, it's about keeping people well and alive, of course. So I think everyone can find that there's benefit to all entities in the community. Financing, of course, everyone needs more money, so that's an easy one. But I think there's a lot of other things that could be more important, more impactful, and sustainable for a lot of organizations. And that's, again, utilizing those partner networks, and as we do through CAMA, leverage supply chains, technical capabilities, technology, workforce volunteerism. That can be very powerful in getting out to training and improvement projects and education. We work with governments, and a lot of times we support, helping them build their healthcare infrastructure. We've reviewed protocols and processes, delivery models. We sponsor campaigns, maybe donate personal protective equipment. So there's a lot of ways of getting involved. And then just a couple more points. Many governments, work with a lot of different partners, but a lot of times they're the same partners. So I think it's, all of us on this call might have some of the same partners and not even know it. When we have those conversations together, I think there's a lot of value in that. We need to ask those questions. Well, who do you partner with in this region or with this government? And I think we can have a lot of impact there. Excuse me. So in closing, there's a lot of different levels of partnership. Regardless of size, anyone can have impact and get involved. So I encourage everyone to focus on shared goals, outcomes, impact focused, identify what's meaningful value in your organization and for you, include all levels of stakeholders, show up, participate, actively engage, join forces, with established groups and initiatives and combined resources, we can be a lot more effective when working together. So, I hope one thing I've mentioned here is something that people can take back and think about in their organizations. So thank you.
Thank you, Michael. Definitely we will take it back. In your words, you said most effective when we work together. And you also emphasize the importance of sharing information across board and working together in a better way. So thank you so much for those words. We'll open up the chat box to the audience. At this point in time, please feel free to share your comments, your questions, and we will take on, the panelists will address those questions. Now, I want to go back to Dr. Caroline. I like how you ended. And like to Michael's point, Michael Sternberg has said that's a whole lot conversation, but I'm sure we can have some insight at this moment, especially in terms of how WHO is thinking about rethinking malaria. And we need to start talking about what can we do differently. So you talked about barriers that, that we are faced to, that affects bringing products or, innovations to markets. What do you think we can do differently moving forward that will enable us to accelerate, bringing of products to the market?
So thanks for the question. And my own personal view is there are just too many steps there. So just to give you, we tried to map what was going on with a recent product that went through and asking ourselves the questions, well, why isn't it still out there? What's stopping it getting there? And if you look at what they have to do, they have to get their stringent health authority approval. Then they have to get their national health authority approval. Then they have to do another trial to show that the drug is effective before it can be used. They also have to get pre-qualification, which is another hurdle on top of the stringent health authority approval, where part of the same information is reviewed again. Then they have to get adopted into the guidelines, the WHO guidelines. Then they have to get adopted into the local guidelines. Then the NMCPs have to request that the product is made available from the procurers, and the procurers have to have that product already on their list or an estimate in order to be able to go forward. At least this, maybe I'm wrong in some of those assessments, but certainly this is what we came to when we mapped it. Now, if you think about that, it sounds like a bit of a hurdle race to me, where you get over one hurdle and then the next hurdle's there and the next hurdle. If you compare this to any other therapeutic area, and I've spent my career in drug development, generally what you do is you get a stringent health authority approval, and that covers you. That says your drug is safe, effective, and has the right level of quality to be used. And then you maybe have some interactions with different payer organizations to negotiate how much you're going to put it out for in the market, or whether they're going to reimburse it. And that's it. That's it. So it's very different scenario from the one that we're talking about here when we're talking about this neglected tropical disease space. So I know there are different considerations there, and clearly there have to be some check steps along the way, but I still think there's an opportunity to take a long, hard look here and say, do we really need all of these steps? Are they all value adding? Are they all required in order to do this? And I would really hope that should we get to the stage of frank resistance, where we need to get products out, that a little bit of pragmatism comes in to say, the patients need the drugs. How do we get the drug to the patient as quickly as we possibly can? Basically to save lives.
Thank you, Dr. Caroline. I wish we had more time. Michael Joos, I would want you to also share some insight on that question, contribute to it. Because I know you're in the same line, innovations and trying to get product out there. I know that all those are the challenges you have to go through as well. So can you help us out and throw some insight into that?
Yeah, and a lot of what Caroline Boulton has already mentioned, I think applies here just as much in the bednet space. Look, we're packing two poisons onto a bednet. We got to be sure that the sleeper underneath is protected, whilst at the same time we're killing the mosquito populations. The vector can reduce in number and get sort of a community effect at the same time. That's really what we're trying to do. But a lot of these agrochemicals are not new. They've been in existence for sometimes decades. They've been very well studied with environmental protection agencies, etc. They've been approved at various levels within, the countries, etc., etc. I think the biggest hurdle for us is the length it takes to put proper randomized control trials in place, and there is a space for those. We understand the reason for them, but they take very long time, and they are extremely costly. And there's two costs to them. One is the cost of actually doing them. The other part is the cost of us then not deploying life-saving tools, next generation life-saving tools during the time that it takes to run them to the end. And then at the same time, we don't have all the answers because the mosquitoes mutate in different rates and different speeds in different places. And so we're never quite sure as to what works when and where. And I think this is just a need for, whilst we're doing all this rigorous check, which there is reason for, that we also come up with maybe some faster moving evaluation tools. What's the efficacy of different bed nets in different areas, in different conditions, different usage conditions, and so on. The corollary of this is we let certain bed nets, once we've got a classification, we then have such low entry thresholds that the specification variation from one bed net to another is night and day. And that is not properly captured in the randomized control trials either. And so again, there we need nimbler evaluation methodologies, very well known in the pharma industry, in the medtech industry, to redo post-market surveillance in a more nimble way.
Thank you, Michael Joos, for that insight. And so quickly, I'll give a few minutes or 2 minutes each to Michael and Dr. Diara. Michael Sternberg. Let me start with Michael Sternberg. You've talked about the number of PPPs you've been involved in as an organization. What are some of the lessons that you say you've learned, as an organization that we could actually take into fostering newer partnerships, especially in the face of COVID-19 and all the diseases that are creeping up? 2 minutes. Thank you.
Okay, good question. I could probably talk quite a long time on that one. But I think to some of the other, things that we've heard today, it's, working together and again, back to coming around the common goals, create some measures that people can agree to. You don't have to agree on everything. You don't have to try to accomplish everything. If you can just focus on one piece of the puzzle that is important for your organization or important for your entity, and then identify and seek people that are already doing that, get, and regardless of the size of funding that you have for that, again, every bit can help and everyone can bring something different to the table that can be very meaningful. So I think it's back to just the working together, seeking the partners and others that are doing work in the same regions with the same initiatives and having those conversations together. It would be amazed on what people are doing out there that you might not have any idea about, and you're trying to accomplish the exact same things.
Thank you, Michael. And so Dr. Diara, how can partnerships be improved on to increase effectiveness in malaria elimination?
I would say thank you, Joos. I would say the key part is how people better know each other and respect each other, because each partner is usually coming with strengths and also elements that you can involve, and putting them together is really where you have 1 + 1 giving you 3. And I will say, like just now, our panel is composed of private sector organizations, but we are different types of organizations. You have the manufacturers, the producers, you have the private, corporate, or for-profit sector. But we also have the NGOs that are private sector in general. They are not public, but it's for-profit, non-profit. And the key is always keep who are we trying to serve, meaning the communities, try to tackle the issues at that level or our workplace. So as we partner, it's really to center our thoughts on what we want to achieve. And here it's zero malaria case. So just very shortly, know each other, respect each other, put the elements together, the efforts, and focus on what we want to accomplish with our clients or our communities or workers. Back to you, Ochoko.
Thank you. Thank you so much, Dr. Diara. This panel, I wish we'd have more time. I've been saying the same thing all over again, but there's so much you have inside of you that you still have to share. But what you've shared so far today has been really helpful, and I'm sure a lot of people have learned in terms of innovation, what we can do differently, and even on partnerships, what we can do differently, how we can strategically foster more partnerships and work together with different sectors. And in a nutshell, we will agree that the challenges that we're facing is bigger than any sector can solve on its own. We need to work together. And I want to thank the private sector that you represent right now. Thank you for all that you're doing. Thank you for supporting the fight against malaria. Thank you for your investment, your competencies, your skills, your time. We appreciate you. And we look forward to doing greater things with you. You know the phase that we're in right now in the world, and we cannot do anything. We can't work without you. So we look forward to more collaborations, more investment, and expansion of our programs. Thank you. To end this panel, I've run into a quote yesterday from Dr. Ranj Punjabi, who is the US Global Malaria Coordinator. He said, "It is not normal for a child to die from a disease that we know how to prevent and treat in the 21st century. It is unacceptable. If we choose to eliminate malaria, then we reject it as normal." I think that is enough for today. We've said so much from beginning till the end, and we're almost wrapping up. And I'm happy that we've made a lot of progress so far in this discussion that will take us moving forward on the road to malaria elimination. So thank you to all our panelists. Thank you so much. We'll have a short break, and then we will have a short video, and then a launch of the End Malaria project. Thank you.
Thank you.
Thank you.